Welcome back. Like it or not, COVID cases are back on the rise, both here in Wisconsin and nationwide. While CDC guidelines still place most of the state's counties in the low community spread level here on Friday while we're taping, hospitalizations are ticking upwards as well, although we are still nowhere close to comparisons from the Delta and Omicron surges. I'm joined now by the state's Chief Medical Officer, Dr. Ryan Westergaard, to discuss. Doctor, thank you so much for joining us today.
Yes, good morning. Good to be with you.
How concerned are you watching this uptick, and how concerned should we, the public, be?
Well, we need to pay attention and we need to be smart. And what I mean by that is we've got great tools to prevent severe disease from COVID-19. And now that the virus seems to be circulating at a higher level, we just need to pay more attention and make sure that we're doing those things. And those, number one, are making sure that we're up to date on COVID-19 vaccines. So if you haven't been boosted, or some people are now eligible for a second booster, now's a great time to do that. And then the other thing that we want people to be more aware of is that there's therapeutics, there's medications that you can take by mouth for people that have risk factors for severe disease. So right now, the epidemic is certainly not as severe as it was a couple of months ago, but it is picking up, and we want to keep as many people safe and healthy as we can.
So for those who are fully boosted, for those who might only have a couple shots of the vaccine, is the vaccine's effectiveness waning at all? What does the data tell us?
Well, the data tell us that after 5 or 6 months, the level of antibodies that we can detect in a person's body who's gotten the vaccine does seem to go down. And in some other countries, when they did studies about who was getting vaccine or who was getting COVID, people who had vaccines longer ago seem to be a little bit of a higher risk. So the general lesson is that vaccines do wane over time, and that's why it's really important to get boosters. But getting boosted is still the number one thing we can do to prevent ourselves from getting very sick. Even if the effectiveness against becoming infected has gone down a little bit with the new variants like Omicron, they're still extremely effective at keeping people out of the hospital and preventing people from dying who have risk factors for severe infection.
For those without pre-existing conditions, for those who, say, are young and healthy, whose last booster recommendation was, say, months ago, when might people like that expect some kind of recommendation for yet another additional booster in the future?
Yeah, we're all following that closely, and I think the best I can say is stay tuned. The goal now for our pandemic response is to save lives and prevent severe disease. People that are in the lower risk category, children and adolescents and young adults without medical conditions, should feel pretty good about our protection against COVID-19 disease. As the data come in, if it shows that there's a strong benefit for getting additional boosters, we've got a good system in place to look at those data and make those recommendations. So right now we don't, but we got to follow it closely.
And what about those, as we just mentioned, those who are higher at risk, have pre-existing medical conditions, or, for example, what parents of children under 5 where there is still no vaccine?
Yeah, that's a really good point. I mean, it's true now that getting COVID-19 for young and healthy people isn't likely to make one very sick, but it's still a really severe infection for some people, and it's still extremely contagious. So think about people who are in your household or your extended family who might have some of those risk factors. That in itself is a reason to try to minimize exposure to the virus. And now some of our countries and some of our counties in Wisconsin are creeping into that high community level. Somewhere in the southeast, Racine and Kenosha, for example, and La Crosse area. So those are places where people now should think about putting a mask on if they're going to be in an indoor area with a group of people, because the virus is spreading more quickly. So we don't want to spread it to other people that are vulnerable to severe infection, and we want everyone who is at risk to know about the availability of medical treatment now. So if you are in that high risk category, talking to your medical provider who prescribes normal medications. We now have an adequate supply of medications like Paxlovid that can be used early after symptoms to prevent people from getting seriously ill.
Are there concerns that the case numbers we are seeing are an undercount from people taking rapid tests, self-isolating at home, not reporting to authorities?
Yeah, they definitely are. So since the very beginning of the pandemic, we've tracked the number of new positive tests per day. And by comparing that level over time, that tells us what direction the epidemic is heading, but it doesn't reflect the true number of people who are infected. That number is quite a bit higher because some people don't get tested. Some people have minimal or no symptoms. So our approach these days is really to just give a general trend or a warning sign of how much disease activity level is there. And the other element that we now look for, that we now communicate about the risk to our communities, is the effect that COVID-19 is having on our healthcare system. So as you mentioned, the new community levels that the CDC has defined now has this additional element of how many people are in the hospital with COVID-19. And that is another reason that we all have an interest in trying to stop the spread when possible. So right now, it's, like I said, getting a little bit more intense in terms of disease transmission, but still our hospitals are in good shape. But it's good to be aware and to be smart.
Anything else that we've missed from this discussion that you'd like to add?
No, I appreciate it. I think it's a good time to start talking about this again. Hopefully, we'll get through this wave, and into the fall, we'll keep our eyes on new vaccine recommendations.
All right, Dr. Westergaard, thanks as always for your time.
Okay, nice to be with you.
When we come back, an unusual decision. The governor is asking his parole board to reconsider a decision to release a convicted murderer decades earlier than his sentence required.